So low back pain is a huge problem in the United States, a huge problem worldwide. So what do we need to do about it? So when you're looking at the low back, again, we talked about straight and curve. All right. So if you start to see, now this doesn't always hold true, but so if you start to get pain that's very localized in the center of your spine, usually that's going to be spine related, right? If you start to get pain that's out here, now you could be dealing with muscle and or spine. So that's where you have to understand, most of the time a muscle, if it's strained, sprained, or whatever, it will get better over time unless you're constantly damaging it with activity, etc. So if something is staying there and it's there for a long period of time and you can't figure out what's going on, I would always look towards the spine, because the spine could be damaged, but it's referring pain a little further out away from the spine, maybe because it's affecting a nerve, it's affecting how the muscle moves. So the muscle is actually becoming damaged because of the spinal movement or misalignment. And so when you get in there and you find an area that may not be working well. So also too, what you can have is you got to make sure you can have patterns, right? So just because you have pain down here, per se, like the top of your glute, doesn't mean that the problem is here. So you have nerve pathways, so your nerve pathways go down through here, right? And so as those nerve pathways come, you may end up having a pain mid-lumbar or upper lumbar when you get out into that outside that glute area, into that upper glute, or above the hip. You can be up in here. And so you'll see a lot of people with arthritis up here, misalignments, scoliosis, etc. They have damage up here, but they have pain out here. Okay, so don't always just think, well, this is the pain, treat it, give me a massage, do me, muscle release or something like that. Now that may help for a short period of time, but the problem may be here. Okay, and you can also have it, and I've experienced this, where you can have trigger points down here that are affecting the area up here. Once you relieve these trigger points down here in that muscle, maybe it be your iliacus, your glute med max, or whatever, you start to relieve those trigger points due to some sort of motion that's aggravating. It could be running, it could be doing exercise, it could be just walking long periods of time, where you can get these trigger points here, and it can actually affect spinal pain and create spinal pain. So once you get that relieved, it will actually relieve your back pain. So don't always just chase the actual location, and usually it's multifaceted. So you're going to have muscle, possibly muscle nerve, possibly muscle nerve joint. Almost always it's at least joint, almost, in all honesty, it's so hard. A lot of people say, is it just muscle? Is it just the spine? It's almost always all of it. Okay, in some degree. And so what you have to do is treat it as a whole to get the true relief that you're looking for when it comes to low back pain. So definitely look at this as a bigger picture. Don't just think that because you have a disc problem there, that here's the only thing you need to be looking at, because you may have a disc problem here because of the alignment here, because your hip flexors are too tight, or because your glutes are too short or weak. So there's a lot of reasons that you can have low back pain, and you can have it in different locations that go in different spots. So have somebody look at this very, very, very well, so they can figure out exactly where that pain generator, the primary generator, is, so then they can figure out what they need to do to fix you up.